Hey, this is Michael from Massage Customs. Today I want to show you a technique called active release technique, and we're going to do it specifically on a couple of muscles. These muscles are going to be really effective if you have headache or tension headaches. So the muscle we're going to talk about today is the levator scapulae muscle, which connects at the top of the shoulder blade and into the neck. And then I'm also going to show you some techniques on the temporalis muscle that connects right here in the temple area and then down into the mandible or to the jaw. But the main muscle that I'm going to work on today is the levator scapulae muscle that connects here and up into the neck. And then I'll show you a few techniques that we do on the temporalis muscle. So, for starters, for this technique you don't need a lot of lotion. You don't need lotion at all because there's not going to be a lot of gliding. But what I'm going to do is I'm going to feel where that muscle inserts. See 2, 3, 4, right at the transverse processes are on the lateral side of the neck. Once I find that tightness and those areas of restriction, I'm going to shorten that muscle a little bit, and I'm going to take it through a range of motion. And as I get further into the stretch, I'm going to apply more tension down towards the shoulder. I'm not pushing inward towards the neck a lot, but more down along the neck. And we'll do a few passes of that. Is that pressure okay?
Yep.
You want more or less than that? Are we okay there? How's that? And that's how you're going to get the attachment at the transverse processes of the cervical spine. Face up, this technique is a little different for the scapular attachment. So I'm just going to take the palm of my fingers here, or the side of my fingers here, and Jess, if you'll come over here. And just right at the medial angle of the scapula, I'm going to apply pressure in and then towards it. Then I'm going to take that, making sure the muscle doesn't slip through my finger, and take that neck through a range of motion again on that muscle. And we'll do a couple of passes, 2 to 3 passes of that is normally pretty good for you to feel it loosen up. So just to give you a better view of what I was doing on when he was face up, right here you have the shoulder blade, right up in here. It angles right in there. The levator scap comes down and attaches right there and then up into the neck. So it comes up here and right up into there. So another way to get that is to angle my pressure just a little bit in and then traction it up and then take your head down to the right. And then I'm going to have that, as he's doing the stretch, I'm also going to take that muscle away from the side because there's nowhere else for me to push that muscle into the bone anymore. So now I'm going to come at it from the other angle to get it from this side. Bring your head back. I can also come down on it this way. One more time, down to the right. There you go. How's that pressure?
Good.
So that's a couple of ways that you can get the levator scapular muscle. Now we'll go ahead into the temporalis. So it's pretty simple. A lot of times what I'll do with my clients is I'll find any tight, tense areas. I can feel some tenseness right there, some restriction right there. And then if I want to add the active release component into it, is I'll find that area and I'll traction it downward along the same direction as the muscle's going, and then I'll just have you open your mouth slow. he's gonna feel that as he opens his mouth further and stretches this muscle further, I don't need to apply more pressure. That stretch is gonna create a lot more tension than I don't need to like jam my fingers into his head and really push hard. I sustain the same pressure, and as it goes, I just go a little bit harder as the stretch opens up. So those are a couple of common areas that can cause some headaches that you might be having. Thank you so much for watching, and again, this is Michael from Massage Customs, and we'll see you on the next one. You need to cut it. Cut it.